Live, where news comes first. This is WECT News.
Hello, everyone. Thanks for joining us. I'm Frances Weller. A new report from the state auditor's office says the majority of nursing homes in North Carolina are not inspected in a timely manner. The State Division of Health Service Regulation is required to inspect nursing homes every 15 months. But according to the audit report, 2 out of every 3 facilities across the state did not get those inspections. WECT's Delaney Tarpley read through the 59-page audit about the lack of inspections. Delaney, did it find any other issues?
It did, Fran. Auditors also found that it's taken the State Department of Health and Human Services a long time to look into complaints filed against nursing homes, all of which could have a negative impact on the people who stay in those nursing homes. The report says untimely inspections can allow poor quality of care to go undetected and uncorrected for long periods of time. For example, auditors found at some nursing homes, residents did not get their prescribed medications, or they got the wrong medications. They learned about residents also leaving the facilities without anyone knowing because of a lack of supervision. When things like this are discovered during an inspection or investigation, the division is required to verify that each deficiency is corrected. But the audit found that the division did not check to see if these problems were fixed. From a sample of 612 corrections needed, the auditor found that 224 corrections were not verified. That's more than 1 out of every 3. The Division of Health Service Regulation did have a statement included in the report that responded to these findings. Chief Deputy Secretary of Health Mark Benton painted a picture of the division being understaffed and under-resourced. Benton wrote, quote, "The NCD-HHS team assigned to nursing home inspections and investigations has been understaffed and undersourced for years. Without adequate staff, this team has struggled with both a 51% increase in complaints over the past 8 years and an increase in the severity of those complaints. Included in each of the administration's last 4 recommended budgets were requests for additional staff, higher salaries, and improved benefits for this team. Despite repeated requests, these investments have not been made by the North Carolina General Assembly." Benton went on to talk about how during the time period that this data was collected from 2019 to 2023, the division was severely impacted by the COVID-19 pandemic. He said it does not reflect how the division performs during, quote, routine times.
All right, Delaney, did the auditor's report have suggestions for how the division can improve their oversight of nursing homes going forward?
It did, Fran. It said that the division needs to start complying with state and federal rules. That means doing inspections of all nursing homes every 15 months and investigating complaints within 60 days of them being filed. But it also suggested leaders should develop a plan in case of future pandemics or crises like COVID-19, so they're able to address inspections and investigations in a timely manner even during those unprecedented times.
All right, Delaney, thanks for that update.